Hello, my name is Dr. Singh. I am a private practice owner here at Family Veterinary Care of Oakdale. Join us on this educational series where I get to educate you, the pet parent, and also our veterinary professionals on all things animal health and industry-related topics. One of the most common things that we get to see in our practice is dogs that are coming in, and the classic symptoms are that they're shaking their head, they're pawing at their ears, they're just very uncomfortable. Owners are concerned about an ear infection, and the symptoms that they're noticing at home is usually shaking the head, itching at the ears. So one of the questions we get asked, so Dr. Singh, how do we treat this? Or what's the plan? How do we find out if there is an infection? So the first thing, patient walks in, history, right? History is probably one of the most important factors. We want to know, when did the ear infection start, right? Has it been going on happened yesterday and it came on super sudden? We were out for a walk and all of a sudden patient just started shaking his head and itching. Has it been going on for a few weeks? Is there kind of a pattern to it? It happens every year during this time of the year. You know, is there a seasonality to the ear infections? Or is it all the time, right? And the other thing we want to know, does this patient love swimming in the water, right? So what are the environmental factors that could be playing a role in the frequency and the severity of the ear infection? So those are really important questions. So once we have a good history on the timeline, the factors around when this happened, then the next big thing is physical exam, right? Physical exam is probably the number one most important factor. All tests and everything aside, is the number one thing that helps us make a successful diagnosis along with the history that the pet owners give us. So we get the history, we do our physical exam. It doesn't matter if it's an ear infection or if it is something else. Our exam always entails a full exam, which we look at the eyes, the ears, the teeth, the gums, the skin, the feet, we feel the abdomen, lymph node pulses, we do all of that. But then the focus becomes how are we going to treat the ears, diagnose what's wrong, and go from there. So the number one thing that we do after we've done a full exam is an otoscopic exam. So we use an otoscope, which is a piece of equipment that has a little magnifying glass and a light that we get to put in the dog's or cat's ears very gently, and things kind of get magnified. We're putting some light in there, and what we're looking for is there lots of redness? Is there lots of discharge? Is there a lot of inflammation that the ear canal is just much smaller? And what is the condition of the eardrum? Can we see the eardrum? Is there a foreign object in there? So otoscopic exam, along with the physical exam, is crucial for us to start heading down the direction of trying to find out what's wrong with the pet's ears. So once we've done that, the next part that we often recommend and is really necessary, because we cannot see infections just by looking at them, because a normal ear debris or ear wax can sometimes look like an ear infection. So typically how we start discerning between, is this just normal debris or is it an actual true infection, is a test called an ear cytology, which is where we take some cotton or some Q-tips, long Q-tips, we go in the ears and we swab the ears. So we're getting the material, either it be brown or yellow or sometimes even a little grayish material. We take the sample, we put it on a microscope glass slide, and then we prepare it by staining it. It's a multi-step process by staining it, and then we look at it under the microscope. And what we're looking for is, are we seeing any evidence of bacteria? Are we seeing evidence of yeast? When we talk about bacteria, what type of bacteria? There's, a couple different types of bacteria that we look at under a microscope. Are there a lot of white blood cells? Depending on what the ear cytology shows, what the otoscopic exam shows, we then decide, okay, what is the course of treatment? We may not see anything on the ear cytology, and on our otoscopic exam, we may see a foreign body. Especially living here in Central Valley, California, late spring to fall, we see foxtails as one of the most common reasons for dogs coming to us with all of a sudden Patient was just fine, all of a sudden started scratching, holding the head sideways, and really digging at the ear. So very commonly seen, but more than often, I would say an ear infection, a bacterial or yeast infection are the culprit for dogs' discomfort. So once we've made a clinical diagnosis, either that be a foreign object, bacteria, yeast, and sometimes just allergies in general will cause dogs to itch and scratch at the ears, and they may not have an ear infection at all. Based on our exam and the ear cytology is when we decide what is the best course of treatment for this patient. I would say 95% of infections can be treated very easily with most common antibiotics, but there are those 5% of cases that either, especially if they're having chronic intermittent ear infections, that they can have very resistant bacterial infections. And those could be hard to manage. So a lot of times in those cases, we'll always start with the basics, but if we cannot get that ear to resolve, the infection to resolve in that ear, then one of the other modalities that we may offer is an ear culture. Ear culture is a modality where we take a sample, a sterile sample, and we send it to the lab where they take the sample and grow it on a petri dish. And then they know exactly what type of bacteria it's growing, and then they will go ahead and put a bunch of different antibiotic discs in this bacteria and say which one had the best effect to kill this particular bacteria, and then we tailor our treatment approach specific to that particular bacteria. 2 or 3 patients can have the same exact bacteria, but those bacteria will not always be resistant or sensitive to the same exact antibiotic, is why we cannot treat every ear infection the same way, and is why some of these diagnostics are necessary. Some of the other diagnostics that may get recommended, which we do often in our hospital, one is a endoscopy, right? If there is an ear that you can't really get in there really well, there's lots of inflammation, patient's quite painful, then we'll go in with a camera to just be able to see everything and flush the ear out really well. In rare cases, we do end up referring patients to a dermatologist. Dermatologist is a board-certified veterinarian that their specialty is skin and ears. And in those cases, and the goal for us referring patients to a dermatologist is not because we don't want to take care of them. It's more if we feel that we've tried everything that we can, we just don't want to see this patient keep going through different treatments. We just want to get it to a specialist because they certainly seek the most difficult cases, and they might be able to come up with a plan and resolution for that patient much quicker if we weren't able to. Is when we refer patients to dermatologists. So that is a general way how we diagnose it. The question often comes, Dr. Singh, well, why did my dog get ear infections to begin with? One of the most common reasons, probably the top 1 and top 2 reason, is allergies being the underlying cause for dogs having recurring ear infections. Some of the other causes would be, dogs that love swimming in the water, right? Bacteria and yeast love an area that's moist, that's dark, and that has perfect conditions for those organisms to thrive and grow. So dogs that do swim a lot, sometimes they are more likely to get ear infections. Not all. I mean, I have lots of dogs that swim all the time and never have an ear infection, but I do think some dogs, certainly I think genetics play a role as well, environmental factors, allergies, water, I think all of those are factors that we do see. And then of course the foreign bodies, right? We have lots of dogs, especially in the valley, that go running around the backyard or go out in the park or run through the fields, and all of a sudden they get a foxtail, and that could be very painful for them. If your pet has any of these symptoms, please reach out to your veterinarian, and you can always call us here at Family Veterinary Care of Oakdale. Thank you so much. Have an amazing, blessed day.